Did the government just say that Tylenol causes autism? Well, headlines are flying everywhere, and there's a lot of doctors jumping into this camp or that camp. There's a lot of political activists that are quick to criticize Secretary Kennedy and the Maha movement or the political party just to get clicks or score points. So, where should you fall on this topic? Well, I think it's important to understand the role of HHS, the research that they're talking about, and how you should apply it to your situation. So, today we're going to cut through a lot of the static. We're going to use straight talk and practical information to help you decide what you should be doing. So, let's get into a little bit of what actually happened. So, the short version is this: the White House and HHS flagged some research that have a possible link between prenatal acetaminophen, that's Tylenol, with autism and ADHD. Well, it made big headlines, but there was a lot of doctors and associations and practitioners that said, whoa, hey, time out, hold on, not quite so drastic. But I think it's important to note that HHS didn't come out and say, hey, stop using Tylenol. All they did was announce that there are studies out there that show a possible link. So it's important for everybody to understand that there is a correlative measure and a causative measure. And this link between acetaminophen and autism or ADHD is actually correlative, but not causative. So the studies don't show that it causes autism and ADHD. So it's a correlation between use. So I don't necessarily think that it's a war against big Tylenol. That's not, I think, what's happening. And I do think it is the responsibility of the government agency to bring these things to the public's attention. So I don't necessarily think that they were doing anything wrong or politically driven, but I think it's important to get out into the public information and risk factors that may not be known. And what we do with it as practitioners, or what you do with it in the public, is entirely dependent on your own research, your own understanding, and what you're comfortable with. Remember that every procedure in medicine or conservative care has a risk benefit profile. Are the risks associated with the treatment worth the benefit you're going to get out of it? Because everything has not just benefits, but also possible drawbacks. So I want to get beyond splashy political announcements or headlines or rage bait or political battles and ask you to just step back, don't choose a camp, and understand what the information is. So let's talk about what the evidence actually shows. So there were multiple observational studies. They suggest that there is a statistical link between prenatal acetaminophen exposure and later diagnosis of autism and ADHD. Now, it's important to note that, how many people are taking acetaminophen during pregnancy? I would say there's probably at least 75 to 80%. So it's hard when everybody is participating in this therapy to create a definitive causal relationship. But so the problem with observational design studies is there are all kinds of what are called confounders in the research or in the observations. The fever itself. So the acetaminophen treats the fever. Did the fever get too high, and is the fever causing problems in utero? Or, I mean, there's a whole myriad of confounders, infections, genetics, other types of medications. Excuse me, I got a frog in my throat. Also, recall bias. So these people are remembering, this is a retrospective, people are looking back and saying, okay, well, did I take acetaminophen during this time? They may not be remembering correct dosage or timing. So there are a whole lot of confounders within these observations that won't be able to allow us to draw causation between these two things. So just don't panic about this just yet, but it is something you should be aware of. So the World Health Organization, and I'm not a big fan of the World Health Organization because there's a lot of political motivation that comes out of it, But the WHO and European regulators, they responded to this announcement. They said that the causal link is inconsistent and, quote, does not justify changing current recommendations, close quote. So I would agree with that statement, although once we hear of a causal, or excuse me, a correlative measure, it would be prudent to use with caution or use prudently or sparingly. So what other organizations are saying is that the risks are low enough with the therapy of using acetaminophen to treat the conditions that are higher risks, such as fever. Fever in pregnancy is not desirable. It can create real risks for mom and baby. The FDA and AAP say there's no new formal prohibition. FDA and pediatric authorities have long emphasized appropriate dosing and risk-benefit decisions. So there's no ban, there's no caution. There's just simply an announcement saying, hey, there are several studies. And by the way, these are legit studies. These are studies out of, let me just find it here. Mount Sinai and Harvard. Yeah, two pretty legit research organizations. And there are some other ones as well. There's, I think, one out of Sweden that came to the same conclusions that drew correlation between these, but not causation. So it's important to be aware and to utilize dosages and recommendations appropriately. Remember that there are a fair number of acetaminophen toxicity cases that show up in the ER every year, and it's people not realizing that there are other medications that have acetaminophen in them. They may not be aware. People are getting too much dosage. So documenting and understanding what we're taking Tylenol for or acetaminophen for is really important. Making sure that the dosage is appropriate so that we don't accidentally overdose, because any therapy or any treatment in excess can create problems. Remember that the difference between a poison and a therapy is dosage. Too much of anything creates problems. So there's no formal prohibition on this yet. So just be aware. Remember that fever and infection in pregnancy, they are not harmless. High fever is linked to adverse outcomes, and so that's why acetaminophen is often used. It's the least bad option. So we need to use Tylenol judiciously and remember that it is a medication. It's not inert. It's not harmless. And so using it for the appropriate conditions in the right amounts can mitigate some of this risk. So how can you apply this? Well, I think it would be prudent to avoid reflexive daily use. So if you're using acetaminophen to treat a fever, I think that risk profile is probably acceptable. If you're using acetaminophen every single day because you have achy low back or achy joints or something like that, that's probably not wise use of the medication. And so for significant fever or significant pain, it may be appropriate to the lowest effective dose in the shortest amount of time. Now, that is consistent with FDA advice, the U.S. the Food and Drug Administration, as well as every single OB that I know. So we can try therapies that are non-pharmaceutical or non-drug at first: hydration, rest, cool compresses, an Epsom salt bath that is not boiling hot, mobility work. You may try conservative care like chiropractic or a PT for mechanical pain. Magnesium-rich foods are also very beneficial. There are many things that we can do to help lower fever, to reduce pain, especially musculoskeletal pain or mechanically induced pain. We can try these things before just dosing on acetaminophen every single day. Also, it's, I think, very wise to log medications. One of the drawbacks to these retrospective analysis is that we're relying on people's memories. And I don't know the last time I ever had a patient that showed me a log of when they're taking NSAIDs or acetaminophen or anything in terms of controlling their pain. They're taking it 3-4 times a day, but they're not logging it. And they don't track other things as well. So common cold medications also have acetaminophen. So there may be double dosing if you're not careful. So don't stack the medications. Of course, if you're pregnant, should not be drinking alcohol. Avoid NSAIDs if possible, unless your OB says otherwise. And keep prenatal vitamins and folate in the dosage that it's supposed to be. And if you can, let's good healthy hygiene is really important. Sleep hygiene, getting appropriate sleep and exercise and activity and nutrition, all of those things are mitigating so that we don't have to use acetaminophen daily. So the important thing is acetaminophen should be a breakthrough therapy, I think, for people, and that will mitigate risks associated with it, but it shouldn't be a dependent medication. And if you have somebody telling you, well, you should don't worry about this announcement, don't worry about the studies, it's all a bunch of BS, just take acetaminophen whenever you want. Well, I don't think that that's wise, and that's probably somebody that's jumped into a political camp rather than looking at research and saying, okay, this may not have a causal relationship, but if it has correlation, it's worth further study. And if something has a risk profile, I think we should pay attention to it. So here's some questions that prompted me to make this video. So somebody asked me, so should I stop taking Tylenol completely during pregnancy? And the answer to that is no. There are no blanket bans. I think used judiciously when you're needed to the lowest effective dose per the advice of your OB. I think it's important to get information from your doctor to know what the appropriate dosage is and to titrate that dose to the lowest possible effective dose. I think that is probably appropriate. Next question is there a proven cause and effect relationship between autism and ADHD with acetaminophen? And the answer to that is a blanket no, it is not proven. And I don't think anybody is holding out there that it is proven. I think they're announcing that there have been studies that have found a correlation between these things. And so we have associations. Causation remains unproven, and evidence is kind of inconsistent. There is more research underway, so just kind of hold on and we'll see what happens. And that's how good science should happen, is we have an observation and that may be possible. Let's design better studies. Let's design better observations. Let's design better ways of finding the association between these two things. And when we get better data, we can come out with that data. So next question is, what's more dangerous, fever or Tylenol? Well, uncontrolled fever in pregnancy carries a lot of known risks, and that's why guidelines still recommend and allow for acetaminophen when it's appropriate. So you need to work with your OB to manage the fever smartly and effectively. I would say the fever is probably worse than the acetaminophen at this point, but again, emphasizing lowest possible effective dose for the shortest amount of time and find other interventions. I can't tell you how many times in my career I've had pregnant women and they're just in chronic pain, low back, knees, hips, and it alters your posture. It alters your gait in walking. And these are all mechanical or musculoskeletal things. So things change rapidly in the body. And regular chiropractic adjustments, regular chiropractic care can mitigate those. And more often than not, typically go through pregnancy with very little pain or discomfort. Right up into the third trimester, everything gets awkward. Sometimes just having the baby is the cure for some things. But it is appropriate to utilize other therapies, other interventions like chiropractic, like physical therapy, like exercise to mitigate musculoskeletal pain. And oftentimes that's what people are taking the acetaminophen for, is for pain. And finding an alternative to that may be beneficial. So are there safer non-drug options for pain? Well, of course there are. We've talked about some of them. Posture fixes, targeted exercises, manual therapies, massages, sleep setup changes, so positional, how you're sleeping, hydration, magnesium-rich foods. There's a whole bunch of things, and either your OB or somebody else who is well-versed and well-educated in nutritional guidelines and supplementation and ergonomics may be able to help here. So there are a lot of things that can be done. There are also alternatives. If there's inflammation associated, curcumin is great. Other people know it as turmeric. Curcumin, the curcuminoids are the active anti-inflammatory component of that. But I'll emphasize, just like with the Tylenol, dosage is really important. The appropriate dosage, the appropriate length of time, and for what are you using it. So if you're pregnant and you're dealing with pain, don't white knuckle it or self-dose daily with acetaminophen. Let's build a conservative plan. It reduces how often you need medication, use it wisely when you do, and mitigate your risk of this correlation between these two things. Don't panic. And if you see announcements from government agencies, don't think that that is gospel. It is their responsibility to get information out into the public. It is researchers' responsibility to create better research and more definitive data. But it is the responsibility to inform the public of possible risks. And I think that that's appropriate. Whether you like this administration or not, I think it is appropriate to say, hey, these studies have come out and it's important for you to be aware of them. Just don't jump into a camp and, I'm with this tribe and we're going to go to war with this tribe. These are legit studies and they bring up legitimate concerns. Anybody that says you shouldn't be concerned at all, I think has a political agenda. I think it's appropriate to be concerned. I think it's also appropriate to understand the risks and benefits associated with these various therapies and then make a judgment as to what is best. Like I said, the fever, we know the risks associated with fever in pregnancy to both mom and baby. The risks of acetaminophen, fairly low, at least currently, until we get better research. So don't panic, be wise, use the advice of your OB, your chiropractor, your PT, whoever's helping you manage pain or discomfort. Hopefully this information has been helpful. If you have questions, you can reach us here at Back in Motion Disc and Joint in Baton Rouge, Louisiana. We'd be happy to answer any questions for you. Until next time, I'm Dr. Justin Walbum. Stay well, stay informed.